Hello, good afternoon, and welcome to Sure RN. This is your review lecture on cardiology. My name is Doc Butch. Welcome to my channel. Please like and subscribe. Okay, ang pag-uusapan natin ngayong hapon ay an introduction on your cardiology. This is a free review series for nurses, and this lecture is sponsored by Sure RN Review Services, Professional Review Services. So, let's talk about the heart. Okay, so the heart, as you can see in this picture, is located in the chest, in the thoracic cavity, and it is protected by two tissues there, two soft tissues, your lungs, and then, of course, your rib cage, and then it sits on top of the diaphragm. So the heart is approximately the size of your fist, and its main function is to pump blood all throughout the system. Without the heart pumping your blood, and nutrients and oxygen will not reach your brain, your kidneys, your liver, and eventually you die. So for a very delicate organ like the heart, it is located in your chest and heavily protected by the sternum and the rib cage on the sides, and of course your two lungs there, and it sits on top of the diaphragm. Okay, so the heart beats every minute, no, every beat, it has it ejects blood from the left ventricle, and we call that as stroke volume. For 1 minute, that is your cardiac output. Okay, so therefore your cardiac output is equals to your stroke volume times your heart rate. That is the amount of blood that leaves the left ventricle per cycle of contraction. And your heart is a muscle. It is a highly specialized muscle called cardiac muscles. There are three types of muscles in the body. Number one is a skeletal muscle, which is voluntary. Number two is a smooth muscle, which is involuntarily controlled. And number three, the cardiac muscle, which is also involuntarily controlled. Because the heart muscles are special, they contain the intercalated disc that you can find into the myocyte, into the tissues of the muscle. This will create an automaticity of the heart to contract on its own. So kahit natutulog ka, your heart still beats. Therefore, you are still alive. Okay, so we have here an anatomy of the heart. You have here the inside of the heart. So you see here the vena cava, the inferior and the superior vena cava, which transmit blood, unoxygenated blood, to the right atrium. And so when your right atrium contracts, it pushes the blood down to your right ventricle, passing by this valve. This valve is located on your right side, no? The right side of the heart has your tricuspid valve. And then you see here the bands and strands of um, cord or tendons, not chordae tendineae. We call this the chordae tendineae that attaches the valve to the papillary muscle, and so your valves will only permit unilateral flow. Okay, so we'll discuss this later. Let's go to the first nursing question of the day. Situation. Let me read it to you. So you are a nurse caring for a client who has been diagnosed with aortic stenosis. Mm. The client has been admitted to the hospital with symptoms of heart failure, including fatigue, dyspnea, and chest pain. So the healthcare provider has ordered an ECG or echocardiogram to evaluate the cardiac function. Question. Let's focus on the question. Okay, so here it is. Which of the following statements accurately describe the function of the aortic valve? Okay, so if you go back one slide before that, the situation describes a lot of things here, your aortic stenosis, your heart failure, but the the question is, what the question is really asking is itong function ng aortic valve. Okay? So the choices are: the aortic valve prevents the backflow of the blood from the left ventricle into the left atrium. Letter B, the aortic valve prevents the backflow of blood from the aorta into the left ventricle. Letter C, the aortic valve regulates the blood flow from the right ventricle into the pulmonary artery. Or letter D, the aortic valve regulates the blood flow of blood from the left atrium into the left ventricle. So again, what we are looking for is the aortic valve. Okay? And ano ang kanyang function? So, go back to the anatomy. Hanapin natin yung aortic valve dito. Okay. So, here, the aortic valve, in this picture, you can see it. It's dividing the left ventricle and the aorta. Okay. So, when the ventricle will contract, you will have the ejection phase of the cardiac cycle. When the ventricle contracts, it pushes the blood towards the aorta, going to the subclavian artery, brachiocephalic artery, to your common carotid or carotid artery, down to the renal arteries, to the systemic circulation, basically. So the aortic valve will close once the outflow or the ejection phase is completed. And the main function of that is to prevent the backflow of the blood from the aorta towards the left ventricle. So let's go back to the question. Okay, prevent the backflow of blood from the aorta into the left ventricle. Therefore, the correct answer for this question is letter B. Okay, so it prevents the backflow of blood from the aorta towards the ventricle because the heart valves only permits unilateral flow. And talking about that, you have two types of heart valves. You have your atrioventricular valve and semilunar valve. So when you say atrioventricular valve, it basically divides the atrium and the ventricles. And when you say semilunar valves, these are your pulmonary and aortic valves. They separate the arteries into your ventricle, and they are shaped like a moon. That's why it's semilunar heart valve. Okay, so what are your AV valves? Your AV valves are your, on the right side, your tricuspid, on the left side, your bicuspid. And what are your semilunar valves? You have your pulmonary valve and you have the aortic valve. Now, let me ask you this question. When the valves, which one produces the heart sound? Okay. Is it during the opening of the valves or is it during the closure of the valve? Please feel free to comment your answer. Which one produces the sound? Okay. The sound class is produced during the closure of the valve. So when the valve closes, it produces the sound. When the AV valves closes, it produces the S1 heart sound. And when the pulmonary and aortic valve, your semilunar heart valves closes, it produces the S2 heart sound. So S1 heart sound, maririnig mo pag nag-close yung tricuspid and bicuspid. And S2 heart sound, you will hear when nag-close ang iyong pulmonary and aortic. So the correct answer in this question again, it's letter B. Very good. Okay, so let's move on to the next question. I only have few questions here for the day because our time is limited. You are a nurse caring for a client who has been diagnosed with atrial fibrillation. The client has been admitted to the hospital for further evaluation and management of their condition. The healthcare provider has ordered an ECG to assess the cardiac function. Okay. Question: which of the following statements accurately describe the function of the SA node in the heart? Let's read the choices. A. The SA node is responsible for initiating the electrical impulse that stimulates the contraction of the ventricles. B. The SA node serves as a backup pacemaker in case the primary pacemaker in the AV node fails. Letter C. The SA node regulates the rate and rhythm of the heartbeat by setting the pace for the entire heart. Or letter D, the SA node helps to coordinate the contraction of the atria and the ventricles to ensure efficient blood flow. Okay, so if you look at this electrical conducting system of the heart, you have different nodes. You have the SA node, you have the AV node, you have the bundle of His and the Purkinje fibers. Each has their own function. So what is the SA node? The SA node is called the sinoatrial node. This is the natural pacemaker of the heart. It is the one that will set the pace of the heart of the entire heartbeat so that the heart will beat accordingly to its rhythm, no? And you can assess this by ECG, our very common diagnostic exam for cardiac arrhythmias. So we would see there if there is a problem into the pacing of the heart kasi we measure the rate and the rhythm of your cardiac function. So let's go back to the question. Okay, so the question states which of the following accurately describes the function of the SA node of the heart? The answer is your, okay, letter C. The SA node regulates the rate and rhythm of the heartbeat by setting the pace for the entire heart. Let's look at the choices. Why letter A, letter B, and letter D are wrong? Letter A, ang sabi dito, the SA node is responsible for initiating the electrical impulse that stimulates the contraction of the ventricles. That is wrong because it does not stimulate the contraction of the ventricles. It sets the pace of the heart. And once the impulse is on the SA node, it's your atrium that will contract first, not the ventricles. Letter B is wrong because it is not a backed up pacemaker. SA node is the main pacemaker. Okay? And letter D is wrong because the SA node helps to coordinate the contraction of the atrial and ventricles to ensure efficient blood flow. No, no. When the impulse is on the SA node, the atrium will contract. When the impulse go down to the AV node, there is a slight delay to allow ventricular filling. And when the impulse goes to the bundles, your right and left bundles, the bundle of His, then there is ventricular depolarization. And then when the impulse goes to the Purkinje fibers, it completes the cardiac cycle. You have the ejection phase. So you can see that in your ECG as an basis for your functioning of your nodes. So you see here, SA node, AV node, the right and left bundle branches, and then your Purkinje fibers. So when the impulse is on the SA node, there is an action potential. It will cause atrial depolarization, and in the ECG, you will see a wave called the P wave. Okay, then followed by the QRS complex when the ventricles are already depolarized through the bundle branches. When the impulse is on the AV node, there is no wave that you can see because there is no contraction there. The AV node delays the transmission of nerve impulse for about a little bit of a millisecond so that to allow ventricular filling. Okay? Moving on to the next question. You are a nurse caring for a client who has been diagnosed with pulmonary embolism. The client has been started on anticoagulant therapy to prevent further clot formation and to improve blood flow to the lungs. Okay, the question is, uh, which of the following statements accurately describe the blood flow through the pulmonary circulation? Okay, A, oxygen-rich blood flows from the right ventricle through the pulmonary artery to the lungs. B, oxygen-poor blood flows from the left atrium through the pulmonary veins to the lungs. Letter C, oxygen-rich blood flows from the lungs through the pulmonary vein to the left atrium. Or letter D, oxygen-poor blood flows from the lungs through the pulmonary artery to the right atrium. So, hindi mo ito kayang sagutin kung hindi mo alam yung circulation. So, let's review that. Okay. Here in this representation, blue means deoxygenated blood or unoxygenated blood or oxygen poor blood. while red is oxygen-rich blood or oxygenated blood. Now, let's start here sa inyong superior and inferior vena cava. All blood from the system or the systemic circulation will go back to the heart. Basically, it will enter your heart via your superior and inferior vena cava, and it will be collected into the right atrium. Then the right atrium will contract. It pushes the blood down to the right ventricle, passing by your tricuspid valve. The right ventricle will contract. It will now push the blood towards the pulmonary artery. Remember, this is the only artery in the adult human body that carries the oxygenated blood. The pulmonary trunk or the pulmonary arteries will bring unoxygenated blood towards the lungs for oxygenation. And oxygenation happens into the lungs through the process of diffusion. So when you say diffusion, this is the movement of gas molecules, uh, particles from areas of higher concentration to areas of lower concentration. So there will be exchange of gases in the alveolo-capillary membrane. The blood will now become oxygenated or oxygen-rich blood. So an oxygen-rich blood will go back to the heart, passing by your or passing through your pulmonary veins. And again, in the adult circulation, these are the only veins that carries oxygenated blood. So nakikita niyo sa picture, it's red because it is oxygen-rich blood being brought to the heart from the lungs. So oxygen-rich blood going to the heart coming from the lungs will be transmitted by your pulmonary veins. Then it will be received by your left atrium, and then the left atrium contracts. It pushes the blood to the, what valve is this on the left side of the heart? It's your bicuspid or mitral valve. Bicuspid or mitral valve. So the blood, which is oxygen rich, will now go to the left ventricle, and the left ventricle will contract. It will push the blood to the aorta, going towards the systemic circulation. And so the cycle goes on and on. Okay, so that's pretty much basic flow of heart, no, of systemic and pulmonary circulation. Okay, so question here again, which of the following statements accurately describe the flow of blood through the pulmonary circulation? Okay, choices. Oxygen-rich blood flows from the right ventricle through the pulmonary artery. Mali na, wrong, because it should be oxygen-poor blood, no, from the right ventricle through the pulmonary artery towards the lungs. Again, the pulmonary artery carries deoxygenated or unoxygenated blood. A is wrong. How about letter B? Oxygen-poor blood flows from the left atrium through the pulmonary veins to the lungs. Mali din, no? Kasi yung blood na nasa left atrium is already oxygen rich blood na yung nasa left atrium. What letter C? Oxygen rich blood flows from the lungs through the pulmonary vein to the left atrium. Do you think that's the correct answer? Oxygen-rich blood, okay, so oxygenated blood flows from the lungs, that's correct, through the pulmonary vein, that's correct, to the left atrium. So C is the correct answer. How about letter D? Oxygen-poor blood flows from the lungs through the pulmonary artery, okay, through the light to the right atrium. That is also wrong. Okay, kasi kung from the lungs siya, ang balik niya sa heart ay through your pulmonary veins. Alright, so I hope you were able to answer those questions, and I hope that you were able to dissect it and learn from this lecture. If you like this lecture, please click like and subscribe and follow me on my channel for more contents like this. Thank you and bye bye. Good afternoon.